Hello everyone, this is Dr. Neeraj S. Rohida and I welcome you all on this training tutorial on DTS Pro. I hope I am audible, the screen is visible. Let this be an interactive session. If there are any questions, they could be just put across in the middle of the training, or we could have a separate question answer session at the end of this session. This would be roughly around a 20-minute session where we will cover the functionality of the 2D software, that is DTS Pro. Right. So that's the opening screen of the software. And I will start by uploading an extraoral photograph here. And this looks good to me. So I will start with the absolute basics, where you can use the center wheel of the mouse to just zoom in and zoom out the photograph, and you can press the center wheel of the mouse to scroll or to pan the image. Talking a bit about photography protocols here is, as you can see, this photograph has been shot using a DSLR camera and very basic studio light setup. As a recommendation, though there is no particular suggestion as to using a mobile phone or a DSLR camera, we have now sort of started to recommend using an extraoral photograph either for documentation or patient presentations, preferably using studio lights and a DSLR camera. The primary reason being aesthetics, and when we are talking of simulations, when we are sort of wanting to present patient treatment plans which are going to sort of change their face, it doesn't harm much to have a nice visual representation. So in a nutshell, you can of course use your mobile phone, which is a much handy tool to use, but the photographic documentation that we get with a studio light setup is definitely much more in appreciation and much more in visual appeal than a routine mobile phone, is a bottom line here. One important suggestion, of course, though, is always have a little gap or a space between the upper and the lower teeth. So a common clinical tip here is asking the patient to say the letter A and then smile. The moment your patient pronounces the letter A, or some of us use the letter E, the moment you say A or E and then smile broad, you typically get what you are looking for in a simulation photograph, that is a good display of teeth and a little intra-incisal space. So these are the two basic requirements. Here, of course, I'm having a dark background or a plain background. Again, more to do with visual appeal, not that you cannot use routine DSLR cameras, but again, talking of visual appeal, a plain background, a good extraoral smiling photo with studio lights definitely add a lot of aesthetic value, particularly during case presentation to big ticket cosmetic cases. So I have uploaded the photograph here, and as we can see, as I go to the next step, the software has auto detected the lip line. Of course, I can just edit these points. So since this is a basic training tutorial, I will just talk you through the absolute basic controls. You can modify these points. So as you can see, when I point my mouse cursor on the black control points, it turns double arrow shape and I can move those points. If I have to add more points, I can just click between any two existing points. So I left click and add more points. And if I have accidentally added points and I want to delete them, I just right click over them. So left clicking between points will add more points and right clicking will delete points. In most cases, though, the software does a more than a reasonable job in detecting the landmarks, and edits generally are not needed. So we go to the next step, where there is marking the interpupillar line and midline. So these two are mandatory steps for any extraoral photograph. Here, of course, the interpupillar line which is detected by the software is not very accurate. So I am just moving the two black control points in the center of the pupil, and I am just marking the midline of the face. This is the facial midline. That looks pretty reasonable, and I press done. Right. So of course, the first point and the quickest simulation that we have in DTS is the instant smiles, which is a very quick chairside motivational mockup. So all you need is a single photograph, and it takes you less than 2 minutes to do the instant smile motivation for the patient. So this is an excellent breaking the ice point where you start communication for a patient who may not necessarily be even interested in cosmetic changes in their smile right in the first appointment. So what I have just done is, the moment I go on the instant smile screen, I see these two control points, that is the green and the blue control point. As you can see, on the top, there are two transparency bars. The first bar, that is the template opacity, controls the transparency of the new smile template, and the background opacity blackens out everything else other than the new teeth. So if I reduce it, of course, I can see what is there in the background. And if I increase it, it blocks it out. I always like to keep it somewhere in between. And I reduce the transparency. I just place my first template using the guidance of my underlying teeth. I can, of course, check the midline to make sure that the position of the new teeth is matching with the facial midline. Once I have aligned or placed a single template, I can navigate through different templates which are there in the library and choose whatever works best for me. So maybe for this patient, I want a template. I love this template. I like this template. This is showing me both upper and lower teeth. Because this template has got both upper and lower teeth, you do not see the background opacity bar. In any other template which is just showing me upper teeth, you will see the background opacity bar too. So I just go back to the earlier template which I selected. Once the positioning is to my satisfaction, I press the preview button and go to the next screen. Of course, here I can change the color of the template so that it blends in well with the original image. So I will start. So I repeat here, when I want to change the color of the template, I just press the adjust button here on the preview screen. The moment I press adjust, I get these three tabs. The first is a tooth shade. We have the lip smoothness and we have the gum color. So we start with the tooth shade. I will increase the brightness of the new template a bit, and it immediately starts to look so much better. I can make teeth warm, that is, turn the shade a little on the yellow tone, or I can whiten them. Of course, in this case, I would prefer to have whiter teeth. Lip smoothness, I will always like to have my template slightly smooth at the lip area so that it blends with the original image there and gives me a very natural looking good simulation. And the gum color looks okay to me, but maybe if you want, you can move the slider to the right, so that makes it a little on the orange hue. And if you move it to the left, it turns the gum more towards a pink hue. So I would like to keep it almost like the way it is. And it has taken me not more than 2 minutes to do this instant smile simulation. Of course, this is not something you can right away do a treatment planning, but this is an excellent starting point to get the patients motivated to talking further, understanding further about any changes, prospective changes in their new smile. What I always like to do is keep the transparency a bit low, so that makes my simulation even more realistic and natural looking. Right? And this is how we present the patient in the form of a running video loop from before to after. So all you need to do is upload the photograph, do the smile area marks, upload an instant smile template, and do some adjustments with the color, and you get a very quick motivational mockup. Now, this instant smiles can be used for most of your cosmetic dentistry cases. They can be used for your FMR full mouth rehabilitation cases, full mouth implant cases. orthodontics, multiple missing teeth, and the list goes on. Of course, we will also see a little bit in details about how do you do the treatment plan and then eventually communicate with the lab. But this Instant Smiles is a very handy tool for your immediate patient motivational mockups. For those who have already been using the DTS Pro software, are familiar with this tool, just as an update here, in the next updates, you will have even more controls on the Instant Smiles tab, where right now, because you are only able to scale them proportionately, you will also be able to horizontally and vertically stretch the smile templates, and your planning window will start right away from the Instant Smile. So whatever you have planned here, you can directly share the plan with your labs. So that makes it even simpler. So just as an update, we are looking at maybe a month from now on to release the latest update. Right. So that's the Instant Smiles. You can export your simulation in the form of a before after image here. It can be exported in the form of a JPEG or a PNG image. You could print or you could directly email it after you have configured your email box with the DTS Pro software. Right. So that was about Instant Smiles. I hope I am clear till this point of time. If there are any questions, I'll be more than happy to take them. We go on to the next screen, which is the smile editing tools. Now on this screen, a couple of tools which can help you in simple simulations, single tooth changes, composite bonding restorations. So we will see how can we do them. The moment I am on the screen, there is something called as an extend tool here. As you can see, the extend tool is on by default. I can control the size of my brush from the top size bar. So maybe I put it across around 1 tooth width approximately. And with the extend tool, I can very easily and quickly simulate any crown lengthening changes. So I can just left click and push, left click and push. So that helps me in simulating any crown lengthening changes. So as you can see, this particular patient shows some boggy gingiva. Of course, the deposits add to the bogginess of it, but you can use the simple tool to present and make the patient understand about the crown lengthening changes. Right? If you want a little more finish, so you can control the size of the brush on top there, and that is good enough for me. I can also use this extend tools to do some basic enameloplasty or basic composite bonding mock-up simulations. Simple cases like an incisal chip repair. I can also, of course, close that diastema, and I will just show you in a moment how do I do that. If you want, you can do some bleaching. So I go to the whitening tab and I increase the whiteness. Typically, the algorithm of the software is coded in a way that when you increase the whiteness by +10, so for example, here the whiteness, this is how the original whiteness of the shade of the patient is. But when I increase the whiteness by 10, it clinically corroborates to 1 shade of clinical whitening. So if I'm wanting to do a simulation for 2 shades of clinical whitening, it is +20, 3 shades of whitening +30, so on and so forth. So we have created a simulation. Let me go to the preview and a compare view. As you can see, a nice quick simulation, simulating some crown lengthening, some bleaching. So let us see what are the changes that we have done in a video loop format. So sometimes simple procedures, simple invasive procedures like a crown lengthening, which there is no other way to show the possible outcomes to the patient because these are surgical procedures, irreversible procedures. This extend tool is a very simple tool. It hardly takes you a few strokes of the extend tool and you can show these simulations to the patient. I come back to my smile editing tool screen. Now, of course, before going to veneers and understanding the 2D plan, I can also simulate diastema closure in this case by using the selection tools. So on the top of the screen here, you see there are 2 tools, the rectangle. When I left click anywhere, as you can see the name suggests, when I left click and drag, This gives me a selection in the shape of a rectangle. And when I click on freehand and when I left click and drag, I can do any simulation in a freehand mode. So for now, I just use my rectangular selection tool. I draw a rectangle, making sure that the edge of my rectangle is in line with the edge of the tooth. I'll put on the facial midline so I know how much to expand this tooth. Now, once I have done the selection, as you can see, I have not enclosed the whole tooth, and which is absolutely okay. Right click inside the selection box and press the first option, that is transform. You see, now this box becomes editable and I just expand this till the midline. I do the same thing on the other side. I'm not bothered about the distal aspect of the rectangle, but I'm definitely wanting to make sure that the mesial edge of the rectangle is in line with the mesial edge of the tooth. Right click, transform, and just expand it. Now you can use this tool also to do some basic movements. I can intrude teeth, extrude teeth, rotate them, so on and so forth. So I can also extrude teeth a bit here. So sometimes you get cases where there could be a single rotated tooth. So you want to just lengthen your teeth, you want to intrude them, so on and so forth. So you can use these tools too. Of course, I'm just not trying to make an ideal plan here, but I'm just trying to show you the controls. I can even rotate my tooth if I have to. So once I have selected a tooth, on the top there is a rotation icon. I navigate on the rotation icon and actually I can rotate that tooth. So we have done a simulation here for closing the diastema with additive means. So we have treatment plan A for the patient. Of course, looks like a Bugs Bunny, but just to talk about the functionality of the software, hence we have just focusing on how have we done the simulation, projecting additive mockup. I can come back on the screen now for the same patient. Many times we have patient in our office who want to understand how orthodontics would or how tooth movements would close the diastema vis-a-vis additive dentistry. So for the same patient, I can actually, instead of selecting a single tooth, select the entire quadrant of teeth. Again, making sure that the mesial edge of my rectangular selection is in line with the edge of the tooth. I repeat the process, right click and transform. And now I will not stretch, but I will use the arrow keys on my keyboard. Let me put this midline on and just move. This will now simulate a diastema closure by moving teeth. I do the same thing on the other side. Select. I want to just emphasize on the point here that we re-emphasize on one suggestion that we always have an open mouth position whenever we are simulating. So repeating the point that asking the patient to say A and then smiling. So this gives you this interincisal space that makes the simulations easier. Because if you have a patient who's closed in bite, it becomes difficult for me to individually move the upper and or the lower teeth. So that's another, of course, again, the gums here are not in harmony. There are a lot of other things to be simulated, but just again, emphasizing on the fact how you can simulate diastema closure with orthodontic means. So now you can present two different treatment options to the patient. One with an additive diastema closure. The other, this could be with tooth movement diastema closure. Right? So decision making can be definitely be enhanced using these simple tools. These selection tools can also be used to simulate some jaw changes. Probably that could be part of another discussion. Right. So that's about the smile editing tools. For now, I will just revert the changes. And as a last part, I would like to talk a little bit about 2D treatment planning and lab communication. So the first part, we typically call as the patient motivational part. Now you want to do a little more detailed planning, which is typically the digital smile designing. And either you do the in-house 3D printing to do the mock-ups according to your 2D plans, or you can share it with your lab. So the last part of this discussion trying to focus a little bit about how do you exactly plan in 2D, or there might be cases where you might have to plan only 2 veneers, 4 veneers, where putting the instant smile templates may not be the most ideal thing to do a simulation. So let us see how do we go ahead and plan the same. Now I am on the veneers screen. As you can see, when I'm inserting, I am getting a basic shape of different types of teeth, which is the oval, triangular, rectangular, and square. I can of course also have the lower teeth in place. Now, if you click on a particular tooth, it will insert that particular veneer or crown. And if I click on the name of the template oval, it will insert 8 at a time. You can of course add more if you want to. So if I go on triangular, it gives me a triangular shape of teeth, so on and so forth. You can of course edit the shape of teeth. I can have the lower ones as well. But for now, I am okay to have 8 upper veneers for this patient. And I click insert. Now, I will just switch off the midline for now on. Even though you may not necessarily want to do a complete detailed planning, a basic requirement or a very important tool that will help you understand where the position of your veneers would be is the width-height ratio. Typically, a width-height ratio in the range of 75 to 85% is clinically acceptable, though we strive to have a width-height ratio of around 80% for the centrals. So this much is more than sufficient for me, even if at this stage I am not looking at doing a complete detailed planning. Again, there would be a separate discussion on complete digital smile design protocol. But for now, the basic planning of achieving an 80% width-height ratio is what tells me that this is where the position of the teeth would be if I am striving at achieving the ideal proportion of teeth. Of course, 80 is not a hard and fast rule. The range is between 75 to 85. A lot of other factors go into governing where the position of teeth is. But for now, let me just put it somewhere around 80. Right. So that's the new position of teeth, if I may say so, which I'm going to plan and share it with my lab. Now I can click and I can individually alter the position of each and every tooth. I can reshape. I can right click inside, and if I want to reshape teeth, make it a little narrow, make it a little broad, so on and so forth, I can of course always do that. So I want my canines to be a little narrow, and maybe I don't want to change the position of the gingiva too much, so I'm just trying to conform to my original gingival levels here. Again, here I can have a treatment plan where I have simulated 6 veneers, 8 veneers, 10 veneers, so on and so forth. So that's maybe I can just do a proper positioning on one side and then replicate the same on the other side as well. Good enough for me. The canine still looks a little wide to me. Maybe I'll just make it a little narrow. Right. So I will just select the whole thing. Now, if I want to select multiple teeth, I can press Control A, which is going to select the entire quadrant of teeth. But say, for example, if I have properly positioned one side, what I will do is I'm pressing my Control key and making a multiple selection. I will delete this. I will select one side and I can just mirror on the other side. Again, Control key, press the Control, do my multiple selections. So I get a uniform, a mirroring of one side on the other. Of course, as you can see, the shape of teeth on both sides is not the most ideal. So I will have to do a little bit of reshaping there. Just wanted to show you how the mirroring function works in case you have to do multiple selections. Again, the canine on this side would be a little broad. That looks reasonably okay. Fine. Now, I'll just throw a little bit of light on a little more detailed planning. Since we are talking of a digital smile designing here, in the planning window, there are different tools which are available for us to help us decide and determine where the position of teeth would be. So the first is a smile curve. I start by checking the patient's smile curve. This is more to do, again, I re-emphasize the point. You can stop the use of the software, Just use it as a motivational communication tool and not venture into this. If you want to go to the next level and do your treatment planning and communicate it to the lab, is where these tools are going to help you to do a digital smile designing. So that's my smile curve, and I'm using the smile curve to check the position of my teeth and place them accordingly. That looks reasonably fine. The next tool is your proportion guide. Now here in DTS, we use a golden proportion ruler. Of course, there are various proportions, but this is a basic planning tool, which will tell you whether the proportions of your teeth almost fall within standards or no. This looks reasonably okay. And now if you have to communicate this to the lab, if you have to measure this and communicate this with the lab, you calibrate the software and use the measuring tool. How do you calibrate the software? You press the calibration button. For now, let me just hide the templates. Let me hide the smile curve. I am done with that. Let me hide everything else. So when I calibrate the software, it asks me to enter a fixed distance anywhere in the patient's mouth. Now this I will be measuring actually inside the patient's mouth using a divider, or on the intraoral scan, or on the patient's model cast. Say for example, I measure this easily reproducible distance. This, for example, in the patient's mouth is say 8 millimeters. I'm just putting up a random value here. Once I have done that, my software is calibrated, and now whatever is the measurements I do, so I can just left click and measure. This is going to give me an accurate measurement value. So I can just left click and drag the measurement, and this now becomes my smile framework, which I can share with my lab. So this is how the 2D smile designing, we have gone into what is called as the digital smile planning or the designing. And from here, we can export this plan, export the templates along with the image. And this is what you share with your lab. So they use these outlines and they use these measurements when they do the 3D designing, or when you do the own 3D designing in DTS 3D software, right? So this was a little bit of light about DTS planning. Of course, if you have any doubts or if you have any questions or need a little more training on the digital smile designing, you can reach out to us on email, and we shall definitely set up a one-on-one session with you in case you need any hand holding on this further. Of course, there are simple videos on each screen which can help you navigate through the functionality of that particular screen. So for now, this is about digital smile planning. I can go ahead and add some color and some textures to it because this is a little more refined planning. This is what I'm going to actually get from the lab. So I will go ahead and add some textures. Now, there are two ways of adding texture to these veneers. The moment I go to the textures tab, there is a textures library. So when I press apply, it inserts the texture right from this library in the veneers. Don't bother about the color too much here because we can change the colors in the next slide. So for example, I like this texture. You can even add a bit of gum layer there if you want to. If you want to hide the patient's original gingival tissue, you can add some bit of gum layer on top there. I can remove whatever is not needed. Good enough for me. Don't worry about the gum part extending beyond the lip because that is going to get cut in anyways. And that's my preview. Doesn't look very natural for two reasons. A, I don't want the gum layer for now. Maybe I am okay without it. So I just go back to the texture screen and I'm removing the gum layer for now on. And maybe I can just go back to my preview screen. Now I will adjust the color of the veneers and I want to make them a little yellow, little warm, slightly decrease the whiteness, slightly increase the brightness. The shadow looks a little too obvious to me, so I will slightly reduce the shadow that you can see just below the teeth. And I can make them a little transparent. So what I always love is to reduce the opacity at the end so that it starts to blend with the image. Looks much better and much natural, right? So this is what we call as a digital smile designing. And this is what you have shared with the lab. So this is the actual measurements done and designed plan, which will then go with the lab. I can go back if you want, just talking about the aesthetic part of the simulation. Probably I could do with the first part of the library here, and I will put texture number 1. It is going to look too dark, but I can of course increase the brightness the same way as we did for the earlier library. So I increase the brightness a bit. You see the aesthetic outcome of the simulation. You see the presentation. It doesn't take a lot for a prospective cosmetic case. A case with say 8 veneers, 10 veneers doesn't take us more than 5 to 10 minutes of our planning time. So I strongly encourage anybody using the software to not only stop at the motivational part, but go ahead and definitely do the 2D planning part and share the treatment plan with the lab or do your in-house 3D printing. Right? So that's the before after simulation. I just want to talk a little bit up here about if you want to keep the patient's original teeth shade on these veneers and not add anything else from the library, is also you can. Okay, let me just stop here and talk about a little point. So in this case, as you can see on the patient's canine, the original canine is showing through. Of course, that might not be the actual case, but how do you tackle this? So once I have done my planning, or once I have inserted veneers, I can go back to my smile editing tools screen. And now on top, there is one more checkbox which tells me the design of the templates that I have done. I can use my same extend tool and slightly shorten it. So in a case, suppose where you are planning to do some coronoplasty, some crown cutting there, this is the tool which will help you do that. Or I can just make a selection using a selection tool such as a rectangular selection tool, right click, transform, and shorten or lengthen a tooth. So whenever you are planning the ideal position of teeth, and if you are planning to cut some part of the enamel, you can just do your 2D plan, do the veneer designing, come back to your smile editing tools and delete the part of the tooth, what you're going to do clinically. So even your clinical coronoplasty can be simulated with this tool. And now I come back to my veneer screen. Now you can see the original tooth is no longer seen. Of course, I can drag the gingiva a bit down here too if I want to, using the same extend tool, or add a separate gingival layer altogether. Coming back to the texture, the last part of today's discussion, if I want to have the patient's original tooth shade or original tooth texture, I will go to the second option, that is self texture. Now here I have to insert the patient's color tooth by tooth. So this patient doesn't have a great texture, but just to show you how is it exactly done is, so I first left click on the veneer. As you can see, the central incisor veneer is selected here. Its outline is turned green. I go back to the patient's image. I left click and drag. So basically I make a selection and select the patient's original tooth and press apply. So as you can see, the patient's original tooth color is come here. So in cases where you are planning say only 2 veneers or 4 veneers and the library textures do not give you a very good simulation, you can go ahead with this method. Of course, I can apply all and press the same color on all the teeth. But as you can see for yourself, the simulations do not look very realistic and natural. So if you're using the patient's own tooth color, it is better that you go tooth by tooth. Of course, if a particular tooth doesn't have a great shade, you can always opt to have texture from the adjacent tooth. But by and large, you generally move tooth by tooth and include the maximum part of the tooth that you can select. I don't want to select till here. I don't want to select only this much. I want to leave that unaesthetic part out and include everything else. I'm not trying to be perfect here, but I'm just trying to give you a gist of how do you insert patient's original shade here. So I have done that. Looks pretty good. Somebody's asked me, will you be able to access the recording of this webinar? Yes, for sure. It will be uploaded on YouTube and you can subscribe to the YouTube channel and you will get the recording on the YouTube channel, that is DTS channel. Right. So I will go back to the preview. I'm sure the teeth are going to look, see, this is the original shade of the patient that I have inserted. Absolutely achievable, replicable, because we are not changing the shade here. So you communicate with the lab saying that you use the patient's original tooth shade, whatever that might be. Again, I can use the adjustments here. I can whiten teeth a bit. I can make them bright or less bright, so on and so forth. What I always love to do is slightly make them transparent, keep them there. So now I am presenting to my patients multiple treatment options, something which is absolutely repeatable, doable, predictable. So we start our simulations. We start the workflow by shooting a single photograph. Now, in this particular case, because I am able to visualize even the gingival part quite well, I am not too bothered about having a separate retracted image. But if I have a patient with a very low lip line where gingiva is just not visible, if you still want to just stop at the motivational part, you need not go ahead and shoot the retracted image. Just a photograph, motivate the patient, stop it there. But if you want to get into a little more detailed planning, which I strongly advise you to do so, have a single extraoral photograph and in the same angulation with split retractors, have a retracted photograph as well and overlap the two. There are separate tutorials available on how to match the extraoral and retracted photographs. But if you have any doubts on that, we can definitely speak a little in detail about that. So once you have uploaded, start by showing an instant smile simulation to the patient. Use it as a motivational tool. Go ahead and do a little more detailed 2D planning. Share the 2D plan with the lab. Or if you want to do an in-house 3D printing, which is very much possible with the DTS 3D software, which helps you do the mockups, you can join the webinar on 3D as well. It will be the emails would be shared with you where you can understand the 2D to 3D workflow. So you can start with a photograph, end with a photograph, where you can understand the entire process of simulations, 2D planning, going ahead to the next step, 3D planning on the patient, and doing a 3D printing and mockup transfer. I repeat, there will be a separate webinar on the 2D to 3D workflow, which you can definitely join once you have the link with you. And then finally, the processes which you share with the lab. So that is a basic about the 2D software of DTS Pro. I stopped my presentation here. I thank you so much for your time. And I am open to any questions. You can just write to me or you can just unmute yourself and share any questions which you have. Thank you so much for your time.